all set for vaccination. Countdown to immunization begins. Nationwide mega dry run tomorrow. Because failure is not an option. Biggest vaccine drive in world. Top focus on India first.
Just 5 days to go now for the big vaccine rollout. The wait is well and truly over. It's literally next week that the rollout is going to happen. Well, prior to the big COVID-19 vaccine rollout across India, tomorrow states will be conducting a huge dry run. They interacted with health ministers of states and union territories, with the health minister of India to review preparedness and seek their personal leadership in a glitch-free dry run. It's the final test tomorrow before the actual rollout. The centre has urged all states to keep a tab on disinformation regarding the approved vaccines. Take a look.
The nation readies for the mega vaccine rollout. Preparations are in the final stage for another round of dry run to ensure efficient planning and management of the immunization process.
कल हम 33 स्थानों पर 33 यानी स्टेट्स में और यूनियन टेरिटरीज के अंदर ये हमारी जो ड्राई रन है ये हम करने वाले हैं.
The mock drill will be conducted across 33 states and union territories after reviewing the feedback on dry run of COVID vaccine in 4 states. It will cover 736 districts. Around 1.7 lakh vaccinators and 3 lakh vaccination team members have been trained on the process to be followed.
तो एक बहुत अच्छी फैसिलिटी यहाँ पे क्रिएट की हुई है और जो ऑफिसर्स में, मेडिकल ऑफिसर्स में, स्टाफ में जो जोश है, उत्साह है, मुझे आशा है एक बहुत ही अच्छा जो हमारा प्रोटोकॉल है, ये सारी चीज़ें बहुत ही परफेक्ट तरीके से यहाँ की हुई है.
In Patna, Bihar Chief Minister Nitish Kumar took stock of the preparations at Nalanda Medical College, where the vaccines would be stored. Remember, BJP had promised free vaccines in its election manifesto.
10 जगहों पर उसको भेजा जाएगा, 10 जगहों से फिर सभी जिलों में भेजा जाएगा और वहाँ से फिर जहाँ भी जरूरत होगा उस जगह पर जाएगा. तो इसकी पूरी तैयारी कर ली गई है. इसलिए हम लोग आज देखने आए हैं कि कितना ज़्यादा हम लोगों की तैयारी हो गई है ताकि किसी तरह का कोई व्यवधान नहीं आएगा.
In Karnataka, vaccination dry run will be conducted at 263 locations across the state. Meanwhile, the Delhi government has placed 3 demands before the centre. These include Delhi be prioritized in vaccine distribution, inoculation be made free of cost, and continue with the ban on UK flights. The Agadi government in Maharashtra has demanded free vaccine for the poor.
मेरी तो ये मांग रहेंगी कि केंद्र सरकार ने जो वैक्सीन है वो फ्री देना चाहिए. एफ्लुएंट क्लास यानी जो रिच क्लास होता है उसके लिए अगर नहीं भी दिए तो चलता है, लेकिन जो गरीब तबका है उसके लिए मदद करना चाहिए.
A team from the World Health Organization visited Gurugram to observe the preparations for the vaccination drive.
Operational guidelines have been followed to the letter, and that's what we have seen today in the dry run. So it's a lot of work, and that's very commendable for the whole team of the PHC and the civil surgeon here. It will be, I think, ready for the vaccination day.
Health Ministry sources indicate that vaccination is expected to start by 13th or 14th January. The final call is yet to be made. Bureau Report, India Today.
So tomorrow is the big final dry run before the rollout starting January 13th and 14th. But what about what happened during the last dry run, which was on January the 2nd, which was a Saturday? Well, here are the 5 big takeaways from the dry run that took place last weekend. Finding number 1, the cold chain logistics have found to be pretty robust. The logistics management has found to be pretty robust. There were some niggles here and there, but those are being corrected. Beneficiary registration has found to be satisfactory, but there are some issues which are again being dealt with at the state level. Biomedical waste management has found to be satisfactory. Again, some niggles that are being corrected. Adverse effect following immunization is still to be looked at a little more closely. More information about that obviously will come out once the actual vaccine rollout really happens. So those are the takeaways from the first dry run. Now take a look at what the second dry run, which is what's going to happen tomorrow, the last dry run before the final rollout is. Apart from Uttar Pradesh and Haryana, all the other states and union territories of India will be on this particular dry run. UP and Haryana have already had their dry run, and now it is the rest of the states of India that will be conducting that final test tomorrow. Joining me live now, here on India First, Rajesh Tope is Minister of Health in the Maharashtra government. Dr. Swapneil Parikh is author of The Coronavirus, is a very well-known physician based in Mumbai. And Milan Sharma is our health correspondent who's been reporting on all aspects of this entire rollout and the dry run that's going to be taking place tomorrow. Minister Tope, I want to come to you first. Can you share details of your state's preparedness? Your state is going to be going in for this big dry run tomorrow as well. How is that going to go for you, and what was the last dry run like?
Yeah, we had a very long meeting, and there was a presentation first, and basically many ministers have lot of queries with them about their states. Important queries were like when actually the program will be rolled out.
Yes.
But yet the date has not been actually declared in the meeting. They will be conveying that date. So that was we were very much excited and curious about knowing the date from which we have to roll out. First was that. Then the second is, yes, the vaccine will be provided free by Government of India at present for the health workers and frontliners and even comorbids above 50. So up till this, it is okay. The minister didn't answer to the question, like after because this consists of only 3 crores of people of total India. So we have to have the vaccination for the entire country, or at least those sectors which are vulnerable. So we were very much anxious to know that which exactly how the vaccine expenditure should be borne by Government of India.
Okay.
And the operational cost also should be borne by Government of India.
Okay, so there are some open-ended questions that remain unanswered this time. Minister Tope, stay with me. I want to bring in Dr. Swapneil Parikh, who's also with us. Dr. Parikh, tomorrow is going to be the last big dry run before the real thing. The rollout's going to be happening starting January the 13th, we're hearing. So tomorrow, in effect, is the last simulated test that, the country has before the vaccine rollout takes place. What kind of concerns will you be looking out for?
Shiv, thank you so much for having me on your show. As we get ready for the COVID-19 vaccination rollout, the largest public health intervention in our history, here are my top 10 concerns. Yes. Number one, speed. We need to vaccinate 300 million people in 6 months. That's 600 million doses, 100 million doses per month, 25 million doses per week. The virus moves fast. We need to move faster. Number two, cold chain failure. This can destroy vaccines. We need to protect the vaccines. We need to make sure the cold chain is intact. Number three, infection control at the vaccination centers. We can't have the vaccine centers become super spreading events. Masks, air filtration, ventilation, and avoid crowding. Number four, second dose compliance. We need to make sure everyone gets the doses as per the schedule. Number five, adverse event management. There are going to be some side effects. We need to make sure everyone is safe through the immunization process. Number six, tech teething issues. The COVID system is brand new. It looks robust, but there can be teething issues. We need to make sure this doesn't happen. Number seven, health data privacy and security. There's going to be a lot of very private information on these platforms. We need to make sure it's safe, private, and secure. Number 8, we need to make sure the science happens properly, the phase 4 trials. We need to monitor the efficacy,
Yes.
the effectiveness, safety, what the impact is on transmission. Number 9, we need to communicate effectively and transparently. There's going to be vaccine eagerness and vaccine hesitancy. So we need to communicate to manage these.
Yeah.
And finally, pilferage and equity. We need to make sure that the vaccines get to those who need them the most and that they get to everyone irrespective of their socioeconomic status. So these are my top 10 concerns as we get ready to roll out the vaccines.
Incredible, succinct 10 concerns from Dr. Swapneil Parikh before the rollout happens, because literally there are no more trials, there are no more simulations, there are no more war games. It's now going to be hitting the ground to get 300 million people vaccinated in 6 months. Minister Tope, coming back to you, Maharashtra was at the forefront in this battle against coronavirus, but with the vaccine arriving, do you think a sense of complacency has crept in? What is your advice to the people of Maharashtra and to all of our viewers listening across the country, because this is a nationwide rollout?
Yeah, it's always that as the COVID-19 virus is still there. Actually, the new strain is also being seen. So, COVID-appropriate behavior is the only message which I wish to give to people of Maharashtra as well as to the people of the country. COVID-appropriate behavior is the necessity at present till we are totally free from the virus.
Dr. Parikh, one final question to you. You know, with the huge number of moving parts that are involved in an exercise of this scale, you know, you've listed out these 10 concerns that you have. The issue of complacency that I just put to the minister, you know, there is a sense that with the vaccine around the corner, people are likely to let their guard down. Is that something that governments will already have accounted for as they begin this rollout?
Absolutely, Shiv. This is so the Ministry of Health and Family Welfare put out a beautiful 88-page document about the COVID-19 vaccine communication process. And in addition to vaccine eagerness and vaccine hesitancy, it talks about COVID-appropriate behaviors. So we need to make sure the vaccines are going to, let's say, when we roll these out, they're going to take off some amount of mortality, some amount of transmission. If we mask, distance, look at air quality, keep our hands clean, that's going to take out another 15 to 20%. When we put all these layers together, we can beat the virus. We can beat the virus. We will beat the virus. And now, hopefully, it's only just a matter of time. Dr. Parikh, always such a pleasure. Minister Tope, thank you for giving us your time. Thank you for being with me. I want to end by asking Milan Sharma, who is our brave health correspondent, who's been out on the ground in all of the locations where the coronavirus story has been playing out. Milan, it's all systems go. No more trials. No more simulations. You know, failure is not an option now.
Definitely, Shiv, failure is not an option, and that's why every district, every block has been told to do a dry run, because these mock drills are very important when it comes to ascertaining little issues that may arise in the real-time rollout of the vaccination drive that's likely to happen on the 13th January or the 14th of January. And that's why in the first dry run that was found to be successful, all districts around the country were told to do this. Once the vaccines arrive at the depots, they have to be transported to the state facilities. From there, they have to go to the districts. What we are hearing is that separate corridors could be created for transport of these vaccines from one point to another. And it's very, very important that each and every person that comes at the vaccine center knows at what time to come, when to get vaccinated, how much time to wait to check for adverse events, and then exit from the center. So it's going to be like a clockwork exercise as big as an election that is done in the country.
And we're going to hope that it takes place without any niggles at all. For a country this size, there will always be some bumps, but let's hope that we've practiced enough and the rollout is going to be absolutely, like you said, Milan, like clockwork. It's going to be a busy 5 days in the run-up, and we will keep you posted at every step.